Hello, everyone, and welcome back to the Wolfie's Wish Pet Loss Support Podcast. I'm your host, Erica Messer, founder of Wolfie's Wish, and I'm here today with Dr. Karen Whala, who is a veterinarian dedicated to helping pets pass peacefully in the comfort of their own homes. I'm really excited to talk to her about educating you on these procedures and how it can be a better experience for you and your family. And Dr. Karen Whalers also ensures that, your pets have physical and emotional comfort in their final moments. She believes that a pet's mental and emotional well-being is just as important as their physical comfort. And Dr. Whala is co-founded Codapet, which is a growing network of compassionate veterinarians across the US who provide in-home pet euthanasia. And I want to go ahead and tell you, if you wanted to look those up, you can Google it, of course, but on our resources page at wolfieswish.com, there's also a link there. She attributes Codapet's success to their strong, supportive team, a remarkable group of partner veterinarians, and a rising desire among pet families to give their pets a peaceful, loving farewell at home. So, welcome, Dr. Whala.
Why, thank you so much for inviting me. I am very passionate about the end of life space, and I'm sad to say that I just recently embarked on it about 7 years ago. Recently compared to my career as a veterinarian, and I absolutely love it. So um, I am yours.
Yes, I think you found your calling and I have found mine, and it's really great to have that. I wake up every day energized and actually excited to I kind of think of, well, what can I offer pet parents today? And it's such a great driving force. Can you tell us a little bit about, you know, the process of in-home euthanasia? I think it's one of those topics that people don't really want to delve into until they have to. And so, for people listening that are anticipating needing to do this, or maybe they have a senior pet and have to start, you know lifting up the blanket, so to speak, or look under the hood. How is this process different and better than in a clinical setting at the veterinarian's office?
I do like this question because I feel like the difference is night and day, and it's not simply because of the location. We're not just simply doing it at home versus in the clinic setting. There's a lot of other factors and variables that I think are positively impacted by that location. Um, and first of all, I believe that the grief journey that each individual has is different, and that the veterinary team can actually influence that grief journey, like all the inputs that you have during your grief journey. Grief journey does not have to necessarily begin from point A to point B. Some individuals, they go up and down and they kind of get there eventually. Some people don't actually ever overcome their full grief. I mean, you might probably understand this and probably
Mhm.
relate to this. Some individuals, when they're facing, let's say, for their pet loss, maybe begin the grief journey long before their pet is even sick. I know that's my personal experience. My dog started to get around 10, and every little thing that was wrong with him, thinking, oh no, is it time? Are we approaching that time? And so I had what I think you would explain as anticipatory grief, and there wasn't even anything to support that. And so the role that I feel that vets can influence on this is the process itself, which can influence the later grief journey. And so I believe that in-home euthanasia versus a traditional setting can significantly impact the grief journey. So just start off about the difference. Obviously, it's whether it's in your own home privately or the traditional vet practice. I used to work at a vet practice, and I we tried to make it as comfortable as possible. We've all heard the term, comfort room, but it's never going to be the same as home. And so, one of the things that the difference is, besides location, is that our pets and us, home is where we have our privacy. It's where it's most comfortable. It's where our anxiety is least or little, very minimized. It's where we can create a more personal journey. It's we can personalize the experience. We can have family members present. In the traditional clinic setting, we can't really invite all of the household pets to kind of have an opportunity to process, whereas in the home setting, they can. And so when a person does make that ultimate decision, which is a really difficult hurdle to overcome, that it's time. Sometimes there's a lot of questions about that, but having a veterinarian come to your home where you have privacy, you're most comfortable as opposed to going into a clinic. You may have gone there many times, but it's not the same. There's strangers there in the lobby. The room itself may have memories from, just doesn't feel like home. Your pets is usually, I find that pets don't necessarily love going to the vet. And so it's kind of hard to get a pet to do, to go to the vet as their last step. There's other challenges with taking a pet to the vet. If they're large dogs. I do a lot of large dogs, and they have problems walking and
Mm.
ambulating, trying to get that big, large pet into your vehicle, and let alone to take them to the vet for that final journey. That can be a hard emotional, thing to overcome. There's also cats. We know cats hate traveling in general. And so trying to get them into the carrier, sometimes just the drive itself can be nauseating. So a lot of times these pets, when it's time, they're painful, and trying to transport them under those circumstances are nauseous is really difficult for them. And so I always tell people that when it's my time, hopefully, it's a good, nice, old, ripe age, I want to be at home, pain-free, like on medications if I need to, and I want to go to sleep in my home, like just pass in my sleep. And so that's kind of we like to call it like a gift, a final gift we can give our pets, by carrying out their wishes, so to speak. Because if it's our wish, I'm pretty confident that it'd also be our pet's wish to do the same. And so, anyways, those are some of the big differences.
Thank you for that. I didn't realize how uncomfortable it can be for the pets just because I haven't gone through that experience yet. Um, and my cat Peachy just went to the vet this morning. He's got some respiratory problems. And it's interesting that you touched upon anticipatory grief, um, because I think I experience that on a regular basis with my cats. And it actually, I think I've turned it into almost a positive experience because I don't take them for granted. And especially with Peachy having some health issues right now, I kind of clocked in like, okay, he's 4.5. Like, he should be around for, another 5, maybe 10 years.
Right, right, right.
But there are no guarantees. And so if we kind of go about our our days with, really appreciating our pets and knowing that there is an end, it helps me really pay attention to them and have more quality time. And so I that's just a personal approach I've taken. So if that's helpful to anybody listening, good. But I think back to what you said about the experience for the pets and their owners, Peachy, for example, he's a cat. He does not like to get into a backpack or any kind of carrier. And, he's pawing at it on the way and crying. And we're so stressed because he's so stressed. So to go into that environment, um, it's just really hard. It makes what is already hard harder.
Correct. Yes.
And I've heard some experiences from my pet loss support group that, they go to the office and sometimes there's like a back door or a side entrance that they can go in, but not everybody is aware of what's going on, and sometimes there's like a lot of noise, or maybe they're accidentally greeted in a very positive way by another staff member who doesn't know they're coming in for that. And so there can be some difficult circumstances, to say the least.
I cannot tell you how many times, where you have the comfort room, and vet clinics will put out a candle in the front, or they'll put a little sign letting them know, this back staff, hey, there's, a very sensitive event going on. And then you'll hear somebody laughing in the background, and it can be really, really difficult to try to undo that kind of feeling for pet owners. Like, not everybody is feeling their level of grief, and it's not to be insensitive, it's just not the best environment for,
Right.
for that. We do try our hardest, but it's hard to
And
do.
that's my plan, is to have in-home euthanasia if I'm gifted that, because, emergencies happen and sometimes we don't always have those choices. But I do want to segue over to, guilt is a really big topic in my support groups. And a lot of people say I waited too long, or they struggle with the right time, and either way they're going to feel guilty about it. um, and I try to bring up that, we're doing the best we can with a being that we can't really communicate with. And, there's this conflict because we know that time is approaching, and yet we don't want to make the wrong choice. And so, do you have any words of wisdom or experience on how pet parents can come to that decision? I believe it's really important for them to communicate with the veterinarian who can guide them on when the time is right, because, there are times where selfishly we just don't want to say goodbye yet, and yet it needs to happen. Can you offer some suggestions in that area?
This is a really tough topic. If it was black and white, I guess we wouldn't be having this conversation, right? There are
Yeah.
so many, and these all unfortunately do influence the grief journey, whether you are making the right decision for your pet. If you're not sure, if you doubt that process or that decision, you can imagine, significantly influence the journey and the healing that you could experience, and how long that takes. If you feel like you're responsible, or guilt, or you have blame in the process in any way. And so a lot of times we have these quality of life assessments. There are black and white decisions that help us. I mean, black and white situations that help us make that decision that it's time. Things like your pet can't breathe, it's struggling to breathe, it's having seizures, and it's mentally not coming out of it. There are certain situations, but I would say the majority of the conditions our pets face, and the owners that have the gray zone of when it's time, are definitely going to fall, in the middle. Like, my pet hasn't been eating, they're losing weight, but yet there's still some signs that they have some enjoyment. In those cases, you're going to need some support to help you with that decision, so that you don't feel like you have all the weight on your shoulders in making a decision and fearing you're going too soon. There are quite a few quality of life assessments out there. They're just tools that can help you with, how much food has your pet been eating? How are they using the restroom? Are they defecating and urinating on themselves like they don't care? Their hygiene. A cat that's normally very fastidious doesn't care. They have dingleberries and knots. That can affect a pet's quality of life. But when you do have the gray zone, you're not sure. Like I said, you really need to, ask your team. Your team will consist of your veterinarian. If you have a veterinarian, if you don't, I would get one, because your veterinarian is going to understand more about the disease process and how it can affect your pet's quality of life. For example, a dog that has heart failure that's actually clinical and is having a hard time breathing, that could significantly impact a decision and kind of help release you of feeling that burden that you're the one making a decision without any support. So a vet can help you on that side. They can't, a lot of times we vets can't say yes or no. Like, in some certain cases we can, but that's not common. But we can provide that information, and to some pet owners that's not enough. And so utilizing your team of your friends and family members who also see your pet, they can give you feedback on whether it's time. If you're the only person that's the caretaker of this and you have friends that come over and they see the decline of your pet maybe a little bit more objectively than you
Mhm.
can, I would
Mm.
consider their opinion. I'm not saying that we go off of that, but these
Yeah.
are all little clues that can kind of help support you on your decision. It's hard to say, but you do have the ultimate decision on your pet's um, quality of life and whether it's time. What I once had a veterinarian use this question for me, and I never thought about it before, but if your pet was in your situation, do you think they would agree that it's time? We all know our pets love us dearly, and so they would only want what's best for us. And so sometimes flipping that around, there's lots of little tools. What do they enjoy doing? They don't enjoy anything anymore. They don't enjoy, barking at the mailman or anticipating the mailman coming, or they don't want to even interact with family members that come over anymore. They just isolate themselves. There's lots of quality of life assessment tools, but basically your veterinarian who can understand your pet's condition, disease process that can affect their quality of life, your your family, friends who also see your pet, maybe not all the time like you do, but they can provide a little bit more of an objective measure.
Mhm.
Sometimes they can be biased in another direction. So, I would probably utilize multiple family or friends that you trust. Um, and also, just quality of life assessments. Using like sometimes we do those every day, sometimes have a friend do it. And accumulating that information, a lot of times you can see that quality of life assessment going down, because a lot of pets in chronic diseases, they have a they have a slow decline, but they'll have a decline and then an increase, and then a
Mhm.
decline and then an increase, and then a decline. And a lot of times when they have the increase, it's like you're waiting, is this the one that's going to bring them up? But you see that there is a steady decline in that. So that's the best I can say. I wish I could say a lot more black and white, but those three tools you can use to give you a good idea, so you don't feel so much guilt in the decision making, which is, I feel like, is the goal, because we want to feel that we did what's best for our pet, and that it's time, and that we are supported in that decision. Um, we
Yeah.
may
You.
we do think of the situation where we're worried about going too soon. But there's also situations where you can feel guilty if you feel like it's time, and others may feel like you're going too soon. So there's also that flip side. I feel like it's time. I with my pet all the time. I feel like it's time, but I'm afraid that my vet won't think it's time. I'm afraid my family members won't think it's time. And so there's also that guilt as well. As
Right, right. And I've heard, as a member of the IHCP, which for those of you listening that aren't aware of that, that's an in-home and hospice association. And the veterinarians in there often say it's better to euthanize a day too soon than a day too late, just because of pain management and, uncomfortable situations and the quality of life of the animal. Do you agree with that statement? It's really hard to make a flat comment like that, or a
I
standard.
think the comment is it's that I it's tricky, but the comment is it's better to go a week too early than a day too late.
Ah,
I
okay, good.
personally would love it to be right on time, right?
Right,
And
right.
so the right on time is sometimes now, sometimes it's the next day. It's I wouldn't I don't want people to feel that way. What I do say is that when we talk during a consultation, I will take the time to really draw out from them comparison between what's in the past, what they've experienced, what their pet's normal behavior is, and what it is now. And a lot of times, just that discussion, seeing videos and pictures of your pet, seeing the before and after, and like I said, using those tools, your vets. Um, right now, when we do the euthanasia, is the right time. I don't really want anybody to think they're going too soon. And I
Yeah,
don't really want to think a person went too late.
yeah.
some pet owners already arrive at the conclusion themselves, sometimes when they feel it's too late after the fact. And so usually then the second pet they have euthanized, they don't want to wait too late like they did. And I find that sometimes they pull the trigger too soon. And so every pet is unique. And I want a pet owner to know that right now is the best time. Once we have decided quality of life parameters, we feel like the disease process, we don't want it to get worse, or we don't want them to be in more pain. We've tried medications, it's not working. Right now is the best time. I know that's a very nebulous thing, but knowing that right now is the best time, I don't want to say, oh, we're a week too soon, but it's good time. No, no, I do not want to address that conversation at all. Right now
Okay.
is the good time.
Okay.
After we've had that conversation, right now is the best time. Um, as
Okay.
opposed to saying a week too early. To me, it's like I don't want to be deprived of a week of my pet's
I
presence,
know.
right?
No.
So to me, I don't use those terms at all.
Okay.
Like, let's
Okay.
talk, let's use the tools, let's understand our pet's disease process because we don't want them suffering. Like, I hear that a lot. And then when we feel like it's time, now is the best time for your pet, right?
I
Um,
love that.
just even if I go into a home and I'm thinking, oh, this would have been good if we had done it a little few days ago. I do not convey that. It's like, let's talk
Okay.
about it. Let's make
Okay.
sure we're on the right page. Even if in the back of my head, I'm like, oh, we would have been good a couple days ago. No, right now, for the pet owner's time, right now, we are making the right decision. It is time. So,
Thank you. Thank you for expanding on that because it is such a gray area. And I recall last year, my parents are serial dachshund owners, like that's their breed. And Lucy was 17. And she, like a lot of dachshunds, they have mobility issues as they age. So she had a wheelchair. And I went to visit, and we knew that time was coming. And I told them about in-home euthanasia, and I was helping them prepare. And I was just so shocked when I came in because Lucy just had this like hazy look. She was vacant.
right.
And I said, "Oh my gosh, you guys, it's time. I'm that objective person. I
That family and friend that could see the
yeah,
difference.
I
Yeah.
really hated to give them that news, but at the same time was so grateful that I could be the one to say that and
Mhm.
say it's her time is now. I think we need to make a plan. And so it is a difficult area for everyone, but I do think getting consults from your environment, from your doctor to help with that decision, and even going into a support group and saying, I'm really struggling, whether it's writing it on Facebook or
Yeah.
voicing it to other people so they can support that experience and give feedback. And I think that is one of the hardest things, a pet parent has to go through. I unfortunately have lost, you know, pets due to accidents. And
Ooh, trauma.
yeah, and I had a senior dog, a lab Sadie, who my uncle was caring for her while I was working, and the day came where she could no longer walk, and I was like 2 hours away, and they had to take her to the vet and euthanize her without me. And it was just one of the hardest days to say, no, 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 wait, wait, wait. I will just drop everything and come now. And, they made that decision on her behalf and for me. And they said, I'm so sorry, but, the office is going to close. They're going to go to lunch. And, you know, it also showed me the boundaries that veterinarians have to do for their own life. They can't wait 2 hours for me to rush over there. And I've since kind of backpedaled and looked at the veterinarian and the clinic side of their responsibilities, but also their difficulties in their jobs and how stressful it is on them. So and that segues to another conversation about how we as pet parents can respect and support veterinarians' decisions, and that we are all trying to decide what's best for an animal without being able to ask a diagnostic checklist or anything. We're just,
Yeah, yeah, yeah.
I was just on the phone with my husband and the doctor for Peachy, and there's all these variables, like it's really hard to answer. So, I like to convey in my support groups that the doctors are doing the best they can with what they have as well. And we all need to work together because it's tremendously difficult for everyone. Um, so I kind of went off on a little tangent, but I always like to give my own experience to relate to
Right,
listen.
right, right.
And, that brings me into, grief support, which is so important to me and has become my life's passion to give pet parents options and tools and resources that were very hard for me that I didn't know existed. And veterinarians have a big play a big part in the journey, right? Through anticipatory loss all the way to the day that the euthanasia happens. So how can veterinarians best support the pet owners during and after the euthanasia, but without being taking on the role of like a grief counselor, right? Because there has to be, they're there to do a scientific and medical, job procedure, but you're directly involved. This is oftentimes a family that you have known for a period of time, and the animal. And this is another hard question to throw out there, but it's important.
Oh, well, I would say the hard part for us vets is not that we're euthanizing a pet we know, because a lot of times it is a relief to help relieve this pet of the pain that we believe this pet is feeling that sometimes may not be fully understood by the owner, or maybe the owner understands better than the vet. The vets don't know everything definitely in this regard. But I believe the euthanasia process and how the vet handles that, it plays a pivotal role in the grief journey and the healthy healing timeline, the process of recovery of that timeline. And so, we started with anticipatory grief, where there may or may not be a reason to have grief. And then there's the actual process itself. And it is up to the vet. And I would say it's a very weighty situation to try to make that process as smooth and peaceful as possible, because that is what an owner is going to remember, and whether it's going to allow them to cast doubt on their decision. And for example, if a pet, if they're given the final medication and they react in any way, that can imprint very deeply and profoundly on a pet owner's grief
Mhm.
journey experience. And I mean, I hear these stories and it just cuts me. But I wouldn't necessarily say that it's up to the vet. However, there are things that we can do to minimize and try to prevent that. The problem is that a lot of people, we are so far removed from what a natural death looks like, that we have an expectation, sometimes in a natural expectation sometimes, of how that process will look. That a pet will just kind of close its eyes and fall asleep and pass in its sleep. That is what we all envision for ourselves and for our pets. And that is not the reality of what death is. That transition from present to absent, from life to death, is sometimes not pretty naturally. And so the weight and burden of that in meeting an expectation that sometimes is not natural, can be a very weighty one on us. For example, not only do we have to deal with, a lot of times, we don't have a previous relationship with the client or the pet. A lot of us in-home euthanasia providers don't. And I overcome that by definitely spending time with the client and bonding with them and letting them know I want what's best for them and their pet. But we have to take an unknown disease process a lot of times. We don't know what's exactly going on with the pet. We have to take a situation of the owner's expectations. We need to consider the drug interaction, the medications we use with the pets, you know, disease process. We need to consider the pet's personality. For example, a very anxious pet might have naturally a higher adrenaline load, and so that can affect how smooth medications operate and work.
Okay.
You need to consider a pet owner's preferences. Sometimes they've had a rough experience in the past. We want to really avoid that now, or sometimes they've never had euthanasia and they have this vision in their head. And so we have to try to meet those expectations, use all that information, and then try to accomplish sometimes what can be considered an almost impossible task. In the home setting is where I do it, but in the hospital setting as well, you know. And so considering disease, pet personality, client expectations, environment, you have a bunch of family members around, the pet's not really used to this level of attention, or, you have other pets, or the clients have their home feels different to the pet owner. Suddenly they have candles and all these weird smelling things. And I always want the pet owner to make your environment like you normally would have it. This results in the most calm and relaxed pet. We all have those pets that don't care, that things are different. They love it, they thrive on it. But when I come to a home and a pet looks a little anxious to me, like, do you normally have a TV on? Do you normally, have radio or some background music? Let's bring that back, because your pet is anxious about something. They know that you're breathing. They can feel that and sense that. But let's try to make that as normal as possible. And a lot of times that can just kind of then we'll spend time chatting, and then the pet will kind of relax, and then we don't have to overcome the adrenaline anxiety part of the process. And so I like to share with pet owners that we veterinarians want it to be as smooth, pain-free, peaceful, and mentally as calming as possible. We want them to just go in their sleep and not feel any clinical aspect is taking place. But that burden is really high because of all the factors and variables involved in that process. And so I try to teach my veterinarians. We have over 100 veterinarians, try to encourage them to consider all the factors that involve this decision. Obviously you have a grieving client, when you first arrive, they're going to be very sad, and that can sometimes affect it. But take that time to help them, make certain that they feel comfortable in the decision. That is a big hurdle. Let's spend time talking about it, whether, sometimes owners like, it's time, what's going to proceed. Okay, we don't have to do that. But yesterday I had an appointment. Owner made the appointment. So somewhere in her, she knew it was time. But when I arrived, she's like, can we just make sure? Like, okay, sure. Like I walk in and a lot of us vets can tell whether that it's time. We can tell based on the facial expression. Cats, one of the assessments that we use for cats can be called a grimace score. Cats will have a facial expression that changes depending on their pain level, their degree of lethargy, how sick they are. It's actually called a grimace score, kind of like when they ask people to point to which facial expression do they feel at the moment. Cats can express that. I believe dogs do too. And so when I ask a person to do, let's say we're doing a telehealth consultation, I'll have them send me specific videos, and one of which is, I want to see your pet's face. I want to see you interacting. I want to see if they've checked out. You mentioned a glazed look. There is an expression in which the pet may be showing signs of, I'm tired. Sure, this could be treated, but I am tired. I don't have the will to keep doing this, and I am ready. And so a lot of times us vets can recognize this. Sometimes some owners may not, but we can help kind of explain that by the pet's expression, their body posture, their language. And so when we come to the home, we want to go over these things with them, and so that we are fairly confident that it's time to proceed. And so then we as a vet will then take all the information that we have, sometimes limited. The pet's really sick, it's been sick, it's weight loss, all the signs point to the fact that it's time. And yet we vets are like, well, we don't know what's going on. Like, does this pet have metabolic derangements? Does this pet, have a tumor somewhere? And we have to create a medication cocktail that alleviates any pain. Even if we're not sure they have pain, we always give them pain relief. We want to make sure that they're relaxed, sedatives are given, and anesthetics are given, because we want them nicely, comfortably asleep. And we want to do that without the medications interacting with the condition. But sometimes we don't know the condition.
Right.
So, yeah.
Right.
So the
Yeah.
burden is pretty much on us to try to accomplish all this with sometimes limited information.
And so for those that are listening and they're going to be planning the in-home euthanasia process, my understanding is that a sedative is given to administered to the pet, and then basically, right, an anesthetic is given after that, which stops their heart. So it's the same sort of the same procedure we go to when we're going undergoing surgery, except that it's taken to stop the heart. It's given at a higher dose. Do I have that right?
Yeah, let me go over the general process. There's hundreds of vets that offer this service, and the general concept is, yes, we always sedate a pet. There's different medications we use to achieve that, but we really want a comfortably sleeping pet. And sometimes, you might, see a few signs as evidence that they're asleep. And then when they are deeply sleeping, we'll test, we make sure, sometimes owners don't notice that we're making sure, but we just want them to spend time with their pet. But once the pet is deeply sleeping and we believe it's time to proceed to the next step, we give them an anesthetic overdose, like you mentioned. That is correct. But it does not stop the heart, and it does not stop their breathing. It actually depresses the brain waves, and the brain, and the process of turning off will turn off the breathing first, and then the heart last. So
Oh,
it doesn't actually stop the heart,
oh,
though directly, I should say.
okay. Okay.
Directly. So it is the most humane method of euthanasia in that the brain is off first before the automatic systems turn off. And usually they turn off in an organized manner. Breathing stops first, and then the heart usually stops sometime later.
Oh, thank you for clarifying that. I think that's really helpful for pet parents to understand what's going to happen, and to know this ahead of time before we're in that heightened stress state
Mhm.
where we can't really comprehend things, right? Um, is really helpful. And I actually don't know, do pet parents get to be holding the pet for that whole procedure, or is there a point, right, when the anesthetic is given that the pet has to be alone?
Um, it It depends on the pet parent and the situation in the pet. So,
Okay.
for example, I prefer, just to give you an idea, I prefer the pet to be where they feel most comfortable. I believe the pet has the ultimate decision on where they want to be. And so
Okay.
when we give the sedative, I want them to choose where they want to be. Sometimes pets are ambulatory, and a pet owner wants them to sleep right here, and the pet's like, I don't want to be right here. And so in this moment, pet has preference where they want to be. And a lot of times the pet will decide, I want to lay on this end of the couch. I want to lay on the bed. I want to lay under the tree, and then secondarily, we'll consider the pet owner's preference. And a lot of times we can achieve that preference after the pet has chosen and has fallen asleep. Let's say it's not in their lap. Then we can kind of transfer the pet to their lap when they're not uncomfortable, painful,
Oh,
and
okay.
the owner prefers that. So that's typically how I approach it. Pet should have the first choice on where they want to be. Secondarily, the pet owner. Sometimes it's the same. Pet likes to be held, owner likes to hold, and that's fine. Um, and then when we give the relaxer, the sedative, it depends if they're in their little cat tree. I've climbed to the top of a cat tree to give a sedative. The cat just loved to be up there, but the owner couldn't be with the pet up there. I had to have a ladder, like a little step stool to get up there. But then as soon as the pet was relaxed, then we could transfer the pet, and then she wanted to hold the pet. In
Okay.
that case, because these pets are often painful, they're elderly, they're confused sometimes, I'd rather them pick where they want to be because they know what's the best position for their condition, whether it's difficulty breathing, whether it's a painful abdomen, or they can't walk. They know the best position for them to relax in. And when a pet picks the position, they fall asleep the most peacefully and quickly. You know,
Okay.
occasionally, occasionally we'll have an owner that's like, I want him to lay right here, and they'll kind of guide the pet into a laying position. And I can just see the pet's like, I'm here because the owner wants me here, but I don't look comfortable. And when I
Right.
get the sedative in that position, you can see the pet just kind of move, and it can hinder the grief process because an owner will misinterpret that sometimes as the pet fighting it when it's
Yes.
not. Okay.
Yes.
And I never want a pet owner to ever think their pet is fighting the process. That'll definitely hinder, whether they did the right thing and help them feel like
Mhm.
it was time. So first thing, I let the pet, because you're in the home situation, let the pet decide where they would like to be. A
Okay.
lot of times it's the same spot. They like the fireplace, they like to be in the family room, or they like to be on the bed. Secondarily, where the owner prefers, a lot of times owners see that the pet is comfortable and they're like, no, let's just leave them there. And so then we'll proceed with the rest of the process there. They like to be on the porch. Yesterday, I helped a pet. She liked to have her nose at the glass door, smelling the breezes from the fields out there. And so they just let her lay right there. It was perfect. She went to sleep smelling her favorite smells, as opposed to relocating a potentially painful pet or anxious pet. So, and of course, secondarily, if the pet owner prefers to hold, then we'll let them do that. Now, you need to consider though that we vets need access to the pet. Sometimes you have like a little 5-pound chihuahua, in your bosom. It's going to be a little hard for us to access the pet for giving the medications. And so third is we do want to let the owners know, hey, we sometimes do need to reposition in order to access a vein. We do want owners to consider that because we can't do it remotely. But primarily pet's preference, secondarily owner's preference. Third, we do need to consider at some point, once the pet is asleep, that we need to access a vein preferably. Sometimes we can't get veins on some of our pets. They're so dehydrated and so frail. But so
Yeah.
that's usually a decision-making process we consider.
Oh, thank you. That is so helpful. And I think it's so good to be prepared when we can, when we have the time to educate ourselves as pet parents. And then, Dr. Whala, that day, when that day comes and the pet is carried away, there's this huge physical void as well as the emotional process that a pet parent is going through. And so supporting them on that grief journey, do you have any um just do the doctors within Codapet have sort of a standard on supporting the pet parents, or is that evolving? And what can you offer to the pet parents listening on how they can prepare themselves for that day of grief, but also that week, and the subsequent weeks? I had Dr. Katie Lawler talk about this time as the surreal period of grief because we're adjusting to the absence of our daily routines have
New
changed.
normal.
There's a new normal, right? We wake up and the pet's not there, and there's this like, oh yeah, and that's for several days. It's a really really hard time. How have you, what's your experience been like in helping families adjust to that?
Uh, this is a really trite saying, but it is different for individuals. I I speak to individuals who almost or usually feel a profound sense of relief that their pet is not suffering. But like you said, that there is a void, and some voids seem larger than others. A lot of times it can be dependent on that pet parent's relationship with the pet, obviously. Um, and I would I'll explain how we handle this situation, but I think the hardest ones are the single individuals whose only housemate and friend and companion is their pet, and then we euthanize that pet. And so that void is incredibly high. Or you have the couple, that's their child kind of relationship, or you have the senior whose pet is is the one connection to their deceased spouse, and they lose that one person, individual that they're helping. The grief can be really profound, obviously, the void. And so what we currently do, and I think there's definitely room for improvement, is that we send out a plethora of grief resources. They're not quite tailored to the situation, but we do, because I think a pamphlet would be good. I used to give those out, and most people I didn't see that they would ask for them, but sometimes I would just offer them all the time, and I'd have owners that just didn't want them. So what we can do is that we offer the owners the option to have follow-up when they book initially. Good or
Okay.
bad, I don't know. We're still testing what is the best. We have pet owners where they receive the grief resources at the usually the same time of day as their pet passed, and that can trigger some negative feelings. And so we're still experimenting as to when would be a good time to receive grief support.
Mm,
I find that there is not a single one best way, obviously. You're going to find some people that are absolutely upset. I speak to them that they received a grief resources
mm,
email at the same time of day, even though it's 3 days later or one day later as their pet passed away, and they felt that it just ripped the band-aid. That's literally the words that this one individual said. It ripped the band-aid. So I don't think there's a one good way. I think we're trying to be able to cater to the vast majority of people and give others options if they choose not to receive grief resources. So definitely an area that we need to improve upon for sure. Some of our vets really would like to hand, an actual grief resource at the time. Um,
mm.
we just need to be emotionally intelligent to know that some do not want that. They feel like it's a reminder, and they don't want it, like they don't want it. and
Okay.
and some are very grateful for it, and some don't know they need it until later. And so
Right.
it's I have not cracked the code on that area. I think it's better to provide it than not,
Yeah.
for sure. Just realize that some individuals, they do not want it. I feel like the biggest impact that I can make as a vet is helping them feel like confident they made the right decision. Try to remove any doubt or guilt they may feel in that decision in the process. And that in itself, to me, is the biggest influence that I, as a vet, can make in that healing journey. Um, but resources, it is absolutely something we could definitely improve upon, and we are. It's not coming fast enough, but it's going to be an experimental trial and error. And so we do reach out to other groups to try to figure out what kind of resources they use. I think the best is to give them what they can choose from, as opposed to
Yeah, I
assuming.
agree. I agree. And it is tough because you do get the people that don't want it. And I love that you ask, on the intake, is this something we can help you with? I think that's a great, barometer, right? And to even, let pet parents know there are resources available should they want them. I remember the day that I took Wolfgang, who was my inspiration for Wolfie's Wish, to the vet, emergency vet, and I left without him. Um, if they had provided me, a pamphlet, I think I was already in such a state of shock and numbness, really, that I don't know how I would have responded. But after the fact, after a couple of days went by, I realized, ooh, I don't think I'm going to be okay. and I need help and I didn't know where to look. So I think it is a sensitive thing, and it really does depend on the relationship with the doctor and the family, right? And there's not a blanket statement, but I do think having something as opposed to nothing is better, even if there is, some negative consequences. I think do you agree that the majority of people are grateful to have some avenue to pursue should they need it, right? And
Yes, I would
especially in the
agree.
form of a pamphlet that can be thrown away or discarded or put in a drawer. And that might be a nice way to present it, is to say, you know what, you might not need this, you might not want this, but I want you to have it, put it in a drawer just in case. Is a general way to approach it. And it is hard. It's really hard because everyone grieves differently and at a different time. There is no timeline. So this whole process is really difficult, but I really appreciate you enlightening us and the listeners as to be informed of what the procedure is like, because it's just, and I'm sure you get some of those calls that are like, hi, I need an in-home euthanasia right now. And there hasn't been any really prep work. And so, for those that go through that, I hope that I hope that this recording, I know this recording will be helpful to families in helping them prepare and to just have a little bit more insight, right, on the procedure and how in-home euthanasia really is a better option. And I'm so grateful that this option exists now, because me growing up, I know my parents had to go take our dogs to the vet. And I think they told me that well, one of them went to go live on a farm, and then when I was a little bit older, actually our second dog Jute just passed away naturally, as far as I know. And so but it is a much better experience for everyone involved, and for someone to feel so vulnerable in their own home and relax, right? Instead of it's not a public setting, but a clinic, they have to go there and go home. And even just that drive of going home without your pet and an
Right?
empty carrier, I worry about families being okay on the road, right? Because I know I wasn't okay. I took a taxi home and I was not okay. And I can only imagine how hard that is to drive. So
Yeah,
for those,
that facing that decision is eliminated in the home environment.
yeah,
Yes. You-
yeah.
yeah.
So thank you so much for your time today and going into this really hard topic. And thank you just as a person to person for choosing this path in your life, because I know you're helping so many people and it's incredibly, challenging, and there's no real easy way to go about it. And I know that your heart is in what you do, and I think it's a really beautiful profession.
Oh, well, thank you so much for allowing me to chat. Sometimes I go off on tangents, but I really appreciate this opportunity to share. I truly, truly believe that pet owners will benefit, and their pets, from doing an in-home euthanasia versus the clinic setting if they can help it. Not everybody can avoid it, but I think it'll just help in the grieving process, whatever that journey looks like for them. So.
So listeners, again, you can go to wolfieswish.com for resources. And Dr. Whala, can you remind me of the website for Codapet? Is it .com?
Yes, it is codapet.com. If you're wondering what coda means, it's the ending of the tail end of a beautiful ballad. And so we do have a team or network of veterinarians that help with in-home euthanasia. So you can go onto the website, codapet.com, and there you can find a vet in your area. If you type in your address or zip, and you'll be directed to a vet in your area if there is one. So hopefully experience in-home euthanasia versus, if I always tell people, I hope you don't have to use our services. But if you do, I desire for it to be peaceful and to help you, and that we will help you that decision if you need that type of support. So.
And for those of you listening, both of our websites will be in the show notes as well, so you can go and find those. But Dr. Whala, thank you again for your time, and I know this is really helpful. And just a reminder for the listeners, if you are grieving or you know someone that is, or you need help planning, end of life care, definitely reach out to Codapet, but also wolfieswish.com. We have a blog, we have resources, and of course a virtual support group as well. So bookmark this in your browser, bookmark Codapet in your browser, so you have something to come back to when that fateful time comes. So you have, you're educated and prepared, and we can help you as much as possible. So thank you for listening, and I will be back with another guest. So stay tuned on Instagram for announcements about that, and definitely, write emails or messaging on topics that you want covered, so that I can provide you with the resources and information that is needed. So again, thank you, Dr. Whala.
Thank you very much. Bye-bye.